Hey everyone,
Hey guys.
welcome to another Travel Therapy Mentor video. We've been doing a lot of presentations recently, and one thing that we get asked about very often in presentation is mentorship as a traveler. And this is often from students, like we present at conferences or schools, and they'll ask should you travel as a new grad? If you do choose to travel as a new grad, what is mentorship like? So we realized that this is a very common question, and it's something that we have talked about in a roundabout way on a bunch of different videos that we've made, but we've never made a video specifically about it, or we didn't have any articles specifically about it either. So I wrote an article about this, and we want to cover it in the video as well, and hopefully answer any questions that you guys have about mentorship as a traveler. So that's what we're going to be talking about tonight is, do you get mentorship as a traveler, the different types of mentorship, how it compares to permanent jobs, we'll provide as much insight as we can. So I'm going to get this video shared in a few different groups, and Whitney's going to introduce us.
All right. Hey everyone. For those that may not know us, my name is Whitney.
And I'm Jared.
And we're both traveling physical therapists. We've been travel PTs for over 8 years now. We both started out as new grads in 2015, and we've been travelers off and on ever since. So we know a lot about the experience of being a new grad traveler and the mentorship opportunities, so we'll tell you some more about that. While Jared is sharing the video in a couple of groups so that more people can join on with us live, I have a couple of quick announcements. So October is National PT Month, so we've been doing a lot of promotions this month to celebrate PT Month. We did a giveaway last week and announced that on our Instagram, and we have another giveaway on our Instagram coming up in a couple of weeks, the week after next on the 23rd. So stay tuned for that if you want to enter to win that giveaway. We're also just wrapping up some sales. Tonight is actually the last night that those sales are offered. One of the sales is specifically for our travel therapy course. If you are thinking about getting started with travel therapy and you want to learn from us step by step how to get started and how to use travel therapy to get on a path to financial independence, you can buy the course at a 40% discount using the code PT Month. Again, that ends tonight, Sunday the 15th. And then another sale that we were doing was a combination of our course and also MedBridge. That one also ends tonight. That one, the code is TTM Bundle, and you have to go through MedBridge first to get the discount with them, and then you will get an automatic email for the discount code for an even bigger discount on our course. But again, tonight is the last night to take advantage of those. But stay tuned. We'll have some other promotions and giveaways and stuff coming up. Also, I did want to announce that, as Jared mentioned, we have been doing a lot of presentations lately. Over the years, we've spoken at a lot of different conferences, state student conclaves, individual schools, things like that. So if you're someone who's watching or listening and you're interested in having us speak to your school or at your state conference, just let us know. We will be home all through the fall and all through Christmas. So we have some more time in the next month or so to do some fall presentations. If that's something that you're interested in, just reach out to us, send us a message, and we can help you out there. So if any of you guys are tuning in live, we would love if you'd just say hello in the comments. Let us know you're watching. Let us know who you are. Are you a student? Are you a clinician? Are you a new grad? Let us know if you're already traveling. Just say hi and let us know you're watching. Also hit that thumbs up button if you wouldn't mind. If you are watching later on the podcast, on YouTube, thank you for watching on there. Also feel free to like the video on YouTube and subscribe to our channel there. And then thanks for those of you guys that will listen later on the podcast. I know we have a growing number of folks that like to listen to our videos afterwards on the podcast platform. So we would appreciate if you wouldn't mind leaving us a review on whichever platform that you listen on. We are going to be doing some giveaways at the end of the year for folks that leave us reviews on social media, specifically on our Facebook page or Apple Podcasts. So you can get entered to win that giveaway by leaving us a review and sending us a screenshot of your review.
Yep. Okay, so as far as mentorship goes, it really depends on the situation. The big thing about mentorship as a traveler is that there's no one-size-fits-all answer because every facility is different. You have to remember that as a traveler, you're going to a facility that would have a job you might take a permanent job at, they just need someone temporarily, right? So as you probably know, if you're a student or a new grad watching this, facilities vary drastically. There's some that have really, really great programs where they'll help you, mentor you. They'll have like a preceptor that you follow, and they can be very in-depth, or they can be pretty much non-existent, where you just go and they say, all right, if you have any questions, let us know. And you start the first day with at least like a partial caseload. So travel jobs are no different. It varies drastically. And Whitney and I are a very good example of this, because when we started, we had very different experiences in terms of mentorship on our first travel assignments. We knew the same amount of stuff. We asked the same questions in our interviews. We took jobs very close to each other, so it's not like a geographical difference. We were in different settings, but the main difference was just luck of the draw. Whitney had very little mentorship at her first contract, and I had a ton of mentorship at mine. And that was just by happenstance. And that's kind of what we usually tell people is, if mentorship is important to you, if you feel like you need a lot of help, then that's something you really need to clarify in the interview. What type of facility is it going to be? Is it going to be one where you just kind of hit the ground running? That's what they expect. Or is it going to be one where they will really help you out and ease you in? And for example, my first contract, my first entire week there, I was just shadowing. And then I had about a week after that where I had a partial caseload, and the current PT there, it was acute care. The current PT was following me and helping me like as an assistant, making sure I was doing everything correctly, show me where things were. And then after that, I had a full caseload starting on like week 3. So that was really easy. Whitney's first contract, she got there and she had like a 15-minute orientation and was expected to see a full caseload her first day. So those are 2 situations where we went into it with the same expectations, the same knowledge, and we had vastly different experiences in terms of mentorship. And that's really what you'll run into as a new traveler.
Yeah, so as Jared mentioned, I was really just thrown into my first job as a traveler, and I had almost no mentorship, almost no ramp-up time. But again, a lot of it goes back to we didn't really know the right questions to ask in our phone interview. So we can't stress that point enough. If you're someone who's thinking about getting into travel therapy and mentorship is important to you, you need to ask about it. Whether you're a new grad and that's why you need some mentorship. And again, new grad could mean a lot of things. It doesn't just have to be your first job. You might still want some guidance and some mentorship for your whole first year and a half, 2 years of your career. Or you even could be somebody who has worked in your field for a long time in one setting, but now you're thinking about getting into travel therapy to switch to a different setting. And in that case, you might want some mentorship or just a little longer ramp up time in training. So if these are things that are important to you, you just have to really stress that. One, to start with your recruiter. So it all starts with your recruiter when you're kind of game planning for your job search. And this is why we stress that it's really important that you get set up with a recruiter who works really well for you and for what your needs are. And that's something that we help people with, to kind of match them with recruiters that we think would be a good fit for their situation. Because there are some therapists out there that are very confident, are ready to hit the ground running. They say they're experienced, say they've worked in home health for a long time. They got it. They feel very confident about it. And they are only going to work home health. And so they're like, I don't need training. I don't need mentorship. I just want to make the most money possible. Put me with the job that's going to make the most money possible, and I'm going to go for it. Well, they might work better with a recruiter who's just, all business, right to the point, help get you the job. Great, here's the job. I'm done. Whereas if you're somebody who knows that mentorship is going to be more important to you, you need a little more guidance, you might want to be with a different type of recruiter who's going to take the time to work with you, understand your needs, maybe submit you to a couple jobs, and then after your interview, if they're not the right fit for you, you can just kind of say, hey, that doesn't really sound like a good opportunity. And the recruiter will say, no problem. We'll get you into the next interview, see if we can find one that's a good fit. But not all recruiters are like that. Some recruiters are very salesy and are just trying to get you into a job so they can, seal the deal, get you working, start making money off of you. So not all recruiters are created equal. So you have to start there, get matched with a good recruiter who works well with your situation, with your desires. And if mentorship is a big thing for you, you want to work with a recruiter who is understanding and maybe a little more compassionate towards your situation.
Yeah, that's extremely important. And the thing about recruiters and companies too, we always get the question also when we do these presentations of what companies are the best, which one should I stay away from, those types of questions, or which recruiters would you recommend? The thing about it is every situation is different. Companies have their pros and cons. There's very few that we would really steer clear of. Most of them, for the right situation, they work for the right person. And same with recruiters. Like, there are some recruiters that we've had really great experiences with that we send to other people, and we get feedback and they're like, that recruiter was terrible, we didn't get along at all, and all this stuff. And we're like, how could that be? Because they're awesome for us, and we've talked to them dozens of times and we've had a great experience with them. And the opposite is true as well. We've had some recruiters referred to us that someone said, oh, they're really great, you're going to love them, and we don't like them at all. So it really depends on what you're looking for. It really depends on personalities, and that's extremely important, especially when you're a new grad, or you're going to travel as a new grad and you're looking for mentorship, because you want someone that's going to be understanding. And there are recruiters, and especially for a certain type of traveler, usually like the traveler that's not as confident, that there's some recruiters that will kind of push you into situations that are not going to be best in your best interest. They're just trying to get a deal signed, be done with it. They don't want to deal with it. And those are out there. And they're not always bad either. That's the other thing, is like sometimes those recruiters are great for some people because they just want to get a job. They want to get in there. They don't really want to spend all the time beating around the bush. They just want to have this transaction done and be done with it. And so for those types of travelers, they're great. But for someone that's like looking for the right fit, they're not a good person for you to work with.
Yeah. So start there, either by asking a friend or someone that you know that has a great recruiter that they would recommend to you, or by asking us, and we can help set you up with a recruiter that we think would work really well for you to be able to help guide you through this process, especially if you're looking for more mentorship. Now, after you get set up with a good recruiter, you also want to talk to that recruiter about what type of mentorship is available from the staffing company perspective before we get into talking about the facility perspective. But from the staffing company perspective, quite often they have a couple of different options to help you as far as mentorship goes. So one of them would be the clinical liaison type person who is an employee of the staffing company. This is usually an experienced clinician that now works in this role as a liaison. And this person can help you if there's any tricky situations at your contract. So you'll know that you have that person in your corner as an unbiased third party if there are ever any issues that arise at the facility. We have actually utilized this type of person to help us before. When we ran into issues at a facility, we would have a phone call with them and say, hey, this is what the facility is having us do. We're not comfortable with it, X, Y, and Z. And we would talk it through with them. And then because they work for the staffing company, they can actually intervene on your behalf if it's something unethical or illegal or whatever it might be, or just an uncomfortable situation. They can really help you, and that's a great form of mentorship to have from the staffing company. So that's one way the staffing company can help you. The second way the staffing company can help you, quite often they'll have a less formal kind of mentorship program where they can set you up with a current travel therapist and kind of match you up with them, and they can be kind of like your buddy that you could talk to.
And it's usually somebody that is also working in the same setting or has experience in the setting that you're going into.
Right. And so if you're a PT, they would probably be a travel PT. If you're an OT, they would probably be a travel OT, so forth and so on. So that can be really helpful to also talk to someone else who is a current traveler and gets the travel lifestyle and has maybe been in those same settings that you're in. So those are two different ways that the staffing company can help you provide mentorship. So those would be some questions that you'd be asking your recruiter and the staffing company that you're thinking about taking a job with before you ever take a travel job.
Yeah, and we had a really good experience talking to the liaison a couple times at one of the companies we worked with. It was situations where the demands that the clinic wanted, one of them was a sniff, it just really was not realistic. And the liaison did a good job of like giving us suggestions to try to make us a little more productive, but also going back to the facility and being like, hey, it sounds like they're really doing the best they can. It sounds like your clinic is not set up great for them to be successful in this type of productivity. And so it wasn't just coming from us. And it was it's a hard conversation to have, but for a person that's unrelated to then go to the manager and say like, hey, they're doing their best. Maybe there's something that you guys can do. Maybe you can set it up so that they can do documentation, with patients, things like that. That will that kind of puts some of the onus on the facility and doesn't just like throw you under the bus. And it's nice to have that person on your side. And then also for things that you have questionable, or the ethics of are questionable. You're asking about like, should I sign these progress notes that were there before I started, or those types of questions. It's good to have someone that has a lot of experience that can help you guide through those situations.
Yeah. So in terms of what type of mentorship is available for travelers, those are two different types of mentorship that could be available. Well, three really: the recruiter, the liaison, and a travel mentor. Those are three different types of mentorship styles that you could be receiving from the staffing company. Now, what are some things that you would want to look for when you're going to looking for the facility, for the type of job? So these are some things that you would want to think about asking and make sure that you get a clear answer on when you do your phone interview with the facility. So this is the phone interview when you actually get to talk to the manager or the director of rehab.
And this phone interview is so important. And the longer we travel, the more we realize it, the more we harp on it in our presentations. Because when we started, and most people, when they start, they're looking at things like, what about benefits? What recruiter should I use? What company should I use? But they don't think at all about how important the interview is. They're looking at that as like a scary thing that they just have to get through. They're not really preparing for asking a lot of questions in the interview. And that is so important because it's your only insight into the clinic that you're going to and what the environment might be like. So really, the most important thing we can stress a lot of times to new travelers is really be prepared for the interview to ask the questions that you need to know to make sure that the clinic is a good fit for you.
Mm-hmm. So especially if you're a new grad, but I would say in any case that you're not super comfortable with the setting, if you're going to enter a new setting, I would always ask what other staff is there, what other clinical staff is there. And ideally, you want to find a facility where you're going to have at least one other person of your same discipline. So if you're a PT, there would be another PT on staff. If you're an OT, another OT on staff, so forth and so on. Ideal, very ideal, especially for a new grad, especially for your first job. Now, get a little nitty gritty with them, right? Like you don't just want to say like, does another PT work there? Be like, are they going to be in the facility with me the same hours on the same location? Because sometimes what we found out is they'll be a little bit shady. Like it might be...
Or they'll be vague.
They're
not intentionally lying, but they'll say things like, yeah, we have other PTs on staff.
Yeah. So that's what ended up happening with my first job is I kind of knew enough to be like, is there another PT there? And they were like, yeah, we have other PTs that work here. Turns out they didn't have any other full-time PTs that would be there with me all the time. They had some PRN therapists that would come in occasionally that I maybe saw 5 times in 13 weeks. There were 0 other full-time physical therapists that were going to be on staff with me to help me. So that's extremely important that you clarify. And if they try to be vague about it, come back to it. Say like, yeah, so can you talk me through like what a day might look like? Like, would I be in the same clinic, in the same room, in the same rehab gym, in the same facility with this therapist? Are they full-time? Do they work the same hours as me? Are they on the same schedule as me? So make sure to ask that. In addition to that, you want to know also, of course, if you're going to have anyone that you're supervising. So like if you're a PT, are you supervising any PTAs? Are you supervising any CODAs as an OT? That can be important to know just in terms of your caseload and things like that. But in terms of mentorship, it can also be helpful because I will say that my PTAs were very helpful at my very first job because I didn't have another PT. The PTAs were actually very helpful. It would have been better if it had been a PT, but those are some good things to ask about what other staff is there. And ideally, you have someone of your same discipline that's there with you all the time.
Yeah, and often if there is someone there of your discipline and they know you're a new grad or they know you're new to that setting, they'll be very helpful. There's always these stories about like travelers and how permanent staff hate them and stuff like that. That has never been our experience. It's always been that the permanent staff is really happy that we're there. They're appreciative that we're taking some of the workload and they want to help in any way they can. And that's almost always what you're going to experience unless you're just in a really toxic environment. But I mean, that's happened to us maybe 1 or 2 times in all the assignments we've taken. So it is very rare that you're going to run into a situation where if there is someone of your discipline, they're not going to be willing to help you. They're almost always going to be very helpful and they'll try to like make you more effective, more efficient with your documentation, more efficient with seeing patients and answer any questions that you have. So that is extremely valuable, especially if you're a new grad and especially if mentorship is important to you.
Yep. So the first thing you want to ask in that phone interview with the facility is about the other staff. And if there's someone there that can answer questions for you and help you if you have questions. Now, the other thing you want to really know about is what's your ramp up time going to look like? What's your training going to look like? So yeah, just kind of ask them in that way, like, you know, how long until I would ramp up until a full caseload? What will my first day look like? What will my first week look like? Because that'll tell you a lot about how much training and mentorship you're going to receive. Because if they're saying, well, you're going to have a full caseload on day 1, well, that may not be enough ramp up time or mentorship for your particular situation. Whereas if they say like, oh, well, we'll, you know, get you on the computer system the first day, maybe have you see one or 2 patients that day, and then, you know, throughout the week, kind of add a couple more. And then that kind of sounds like maybe you have a full week before you have a full caseload. Then maybe you're more comfortable with that. But you want to get a feel for what that's going to look like. And if you're not comfortable with it, maybe you say that to them at that time. Say like, you know, I'm not sure if that's going to really work for me. Is there any way that we could have me shadow the other PT for a little longer before I have a full caseload or something like that?
Yeah, and another thing to mention here is that travel assignments vary a lot, like we said. And there are some assignments where you're going in to take over for someone else's caseload. So maybe that person just left, or they've been gone for a little while and they've just been trying to, the rest of the staff has been trying to absorb that in the meantime, and then you're going in and you're taking over basically a full caseload. There's other situations where there wasn't another permanent person that left. They're trying to build up a caseload to hire another permanent person. And so you're starting, and sometimes in that situation, you won't even have treatments. You'll start out as a PT or an OT or an SLP, an evaluating therapist. You'll start out by just evaluating your own patients. So maybe the first day you have 2 evals, and then the next day you have 3 evals, and then the next day you see one of those patients you saw from your first day, and then 3 more evals, and you just build up your caseload. And if you're a new grad that you feel uncomfortable going into like a really busy clinic right away, then you want more of that latter type of case where you're building your own caseload and you're not just being thrown into a full caseload that you're taking over. Because even as an experienced therapist, that's difficult.
And this is more for like typically for outpatient, kind of what we're describing here. On the flip side of that, sometimes it can feel overwhelming. We're going to specifically talk about outpatient for a second here. We talk to a lot of outpatient PTs who they get thrown in and they're like, well, they're giving me 5 and 6 evals a day this first week. This isn't sustainable. And you need to have clear expectations and communication where it's like, is it going to be like that forever? Or are you only doing this because it's my first week and I need to build a caseload? So sometimes it can feel really overwhelming to have so many evals that first week, but then if they're like, oh no, it's not going to be like this forever, but if you don't know that, if you don't ask that question, then you're going to be like, I got to get out of this contract. And we've talked to so many outpatient physical therapists that are just trying to get out of there because they're like, this is not sustainable. I can't do this.
Yeah, and in some cases it really isn't sustainable. In other cases, you're just building a caseload, and that's part of it, is evaluating a lot of people to build a caseload. Nick's in here. What's up, Nick? What is your experience with ramp-up time? What would you say on your assignments has been your average ramp-up time?
Yeah. Hi, Paige. Hi, Joey. Hi, Daisy. Hey, Allie. Thank you guys for tuning in. Feel free to say hey in the comments if you're watching or if you have any questions. But so yeah, just try to get a feel for it. I would say try to have as much communication as possible to see what that's going to look like, to know if it's something you're going to be comfortable with in terms of ramp-up time and how much mentorship. And again, like kind of ask, is the other PT or OT or SLP, are they going to be the one training me? Am I going to shadow them, or are they just kind of there in case I need to bounce some ideas off of? And just get a feel for what that looks like.
Yep. So we talked about our experiences from like basically we've had situations where we had 0 ramp up time at all. We just got there, got introduced to the clinic manager, and then we had a patient basically waiting, to there's been situations where it's been 2.5 weeks before we have a full caseload. But what is the average? So there's a wide range, obviously. The average is probably 1 to 3 days of ramp up, I would say. And in some cases, if you're a new grad and you like really express in the beginning that you're a little nervous and the clinic manager is very accommodating, maybe like a week of ramp up time, where, like we talked about, you might have a couple patients your first day, and then maybe a half a caseload your second day, and then the third day maybe you have 3/4 of a caseload, fourth day you have a full caseload. So normally it's going to be something like that, and often the first day, you're getting acquainted with the documentation system. Sometimes there'll be like, test patients or a fake patient chart you can go in and try to write evals to just see what it's like. A lot of times you're doing like training modules and stuff, so you're just kind of being eased into it, and that is definitely a much better scenario, especially for a new traveler.
Yeah, and I would say for some of the inpatient jobs that we've done, whether it was hospital or it was skilled nursing, especially if they had other people on staff, sometimes they would try to give us a pretty full caseload the first week, but quite often we weren't ready for it yet because of the documentation, and we ended up taking more time than what they expected doing the documentation. And so in those cases, sometimes we just ended up getting overtime the first week to fit everything they thought we could fit into 40 hours that first week. We really couldn't, and we were just like, sorry, we're still learning the documentation system. Or I had some instances, especially like in skilled nursing, where they tried to give me a certain number of patients and I was like, I just can't, I'm not proficient enough with the documentation system yet. So they ended up moving some of my treatments off to the PTAs, or telling me I could cut down on my time for some of the visits in order to try to get more visits in. So there can be some flux there too of like the caseload they're giving you.
Yep.
So you just have to have that feedback with them. But it definitely varies. I think something that's really important to think about in terms of travel jobs, as Jared mentioned, is a lot of these jobs are the same jobs that you could be going into as a permanent therapist. And you're going to have this wide range of what it could look like. It's just a little bit harder because now you're going into a lot of different jobs. You're doing contract after contract after contract. So you're having to ask these questions a lot more often instead of just like if you were a new grad who was going into your first job, you would only have to deal with it once. But now you're having to deal with it more often. So you just have to do more screening and making sure that each and every job is suitable for you. Because there are new grads going out there and taking some of these jobs permanent and then finding out the hard way that they aren't suitable for them, but then they only have to deal with it once and they just work through it. But you're just having to do it more often now. So you have to really do a great job of screening all these facilities on the off chance that you get one that is one of the bad ones.
Yeah, and that's another thing to talk about is, so travel jobs, mentorship or ramp up or whatever, that varies drastically. It also varies drastically for permanent jobs. So then the question becomes, do you really get less mentorship or ramp up as a traveler than you would as a permanent therapist? And the answer there, again, depends. I can say from my experience that when I took my first travel job as a new grad, I was very curious as to what my classmates, what was happening with them, what their experience was like starting at a new clinic, and how like mentorship and ramp up and things like that, how it compared to them. And like I said, I had a very generous first contract in terms of the ramp up and mentorship that I got. But I had more than all but one of the people in my class that I talked to in terms of mentorship and ramp up time. And they were all taking permanent jobs. So does it really vary? Or is there really a big difference? It really depends on the situation, because there's a lot of permanent jobs that will advertise mentorship. But what they mean by mentorship is probably a day ramp up, maybe 2 days of ramp up, some training videos, and then there'll be another PT on staff that you can ask questions to, or another therapist of your same discipline that if you get confused about documentation or you have a patient situation, you can ask them questions. And that's basically what their mentorship program is. So in that case, it's almost the same as a travel job, and there's not really much difference. But like we said earlier, there are some permanent jobs that are really great. And we actually were on a panel last week at a school, and we were the only travel therapist there. Everyone else was permanent managers at different clinics, and one of the questions was about mentorship and all that stuff, and all the managers there were basically saying that it really depends, and that as a permanent therapist graduating, you really needed to nail down what they meant by mentorship, because mentorship is a buzzword that all facilities kind of throw out now, hoping to attract new grads. They'll say, we have mentorship, and then the new grad's like, oh great, I want to work there. And the mentorship is just that. It's a 2-day ramp up, and then there's a therapist there that you can ask questions. And then in that scenario, it doesn't differ at all from travel. It's almost exactly the same.
Yeah, I will say one of the managers that was there was from our local hospital system, and she was explaining our local hospital is a level 1 trauma center, and she was explaining that the ramp up time that they get there is actually a really long time. They are following a preceptor for a long time, and they're getting experience on all these different units. And so they don't even have a full independent caseload until like 3 months in a lot of cases. And I was like, wow, that's pretty amazing. But
Yeah.
what I think that is because it's so challenging at these level 1 trauma centers, and you can kill people if you're not careful, because some of them are very fragile medically. So when I was thinking about it in terms of how that relates to travel therapy, I was like, wait a minute, that's why a lot of hospital systems, especially these bigger level 1 trauma centers, will not take new grad travelers, because they're not going to have the time to train you the way that they would typically train their new grad permanent employees.
And they don't trust you to just come in there and start seeing the patients that may be in a very fragile situation.
Right. So that's, I would say one of the outliers is a facility like that does provide a really thorough mentorship program, whereas I think a lot of outpatients, skilled nursings, small hospitals, home health don't do as much training and ramp up or mentorship for even their permanent employees.
Yep.
And so I think you have a very similar experience as a traveler in all of those settings. And when it comes to big acute care hospitals, you just don't get those jobs because they just won't take you. So it's either you go into it as a new grad permanent therapists in order to get their mentorship program, or they just most likely won't hire you as a traveler.
And often those big level 1 trauma centers, they won't even hire you if you're not a new grad if you don't have experience in acute care. So they are very picky about who they hire, and I'm glad they are, because you would not want someone that's unprepared to go in there and have just a few days and then be expected to see a full caseload of people that could be in life-threatening situations.
Yeah, and so a little bit of an aside about that, if that brought up a question in your mind of, well, I want to do acute care, so how am I ever going to do it as a traveler if I did get into it as a new grad? It's been our experience that a lot of smaller hospitals will take you as a new grad traveler, but you definitely increase your chances of having a hospital want to accept your application. If you had an internship in acute care, they're a lot more likely to take you. And also, if you're willing to sign on for like 6 months instead of just the typical 13 weeks, they'll be a lot more likely to take you as a traveler if you commit to them for that amount of time, so they can afford to give you a little more ramp up in training, because now they're kind of investing in you by giving you that slower ramp up and more training. So like Jared ended up staying at his hospital job 9 months. He didn't sign on 9 months initially, but I know they were extremely thankful that he ended up staying 9 months, because they gave him a full 3 weeks of ramp up time and kind of invested a lot in him, right?
Yeah.
So that's one strategy you could use if hospital systems are what you want to get into as a traveler.
Yep. Okay, what else do you want to talk about?
Yeah, so in addition to what we've already talked about in terms of what types of mentorship you can get, right? So we have what comes from the travel company, that's your recruiter, your clinical liaison, your travel healthcare buddy they can match you with. What kind of mentorship the facility can offer you directly would be the other PT or OT or SLP on staff. They can offer you a certain amount of ramp up time and training time. Now, kind of an inherent benefit that we think that comes with travel therapy that's not really like obvious, but it's kind of like, what's the word I'm looking for? Like a
unique perk?
Well, there was we have an article about something that's like, anyway, not as obvious of a benefit that I was trying to get at. Something we found as travelers is we learned from so many different clinicians and so many different facilities that was almost like an untalked about type of mentorship.
Yeah, this was something I really started thinking about after we'd been traveling for a few years. And I talked to, again, some of my classmates that had basically taken perm jobs and stayed in the same job for that whole time. And I was thinking, like, there were some classmates that probably had a better training or mentorship type situation. But often what happens is you get into a routine and into a rut, kind of, and you're just kind of treating the patients the same way. That's what happens to a lot of therapists. And because we traveled, we never did that. And so not only did we go to a bunch of different settings at a lot of different facilities, saw a bunch of different patients, but we also got to learn from so many different therapists. And I think after 3 years, I was looking back and I was like, I've worked with like 50 different PTs, and I've gotten to learn from all of them. And I got to see their patients and, see how they communicated to the patients and what they told the patients, how they educated them, all these different things. Whereas some of my classmates, they went to a clinic that had one other PT in it, and they only worked with that one PT for their whole 3 years after they graduated. And I was like, it's really valuable not only to work with a bunch of different clinicians, because you see a bunch of things they do that you can pick up, like little things they say or little ways they educate or little cues they give. And I picked up so much of that stuff over that first 3 years working with a bunch of different people. But then also I picked up things that I did not want to do. And I learned from a lot of PTs that had gotten in like those major ruts, and they just basically had like a cookie cutter plan for every patient depending on what their diagnosis was. And I was like, oh man, I don't really want to be a therapist like that. And so I think getting that broad range of perspectives really helped. Learning from a bunch of different clinicians, both pros and cons, good and bad. And then the other thing was that we got to learn a lot about different ways that a facility can be run and different management styles. So there were some clinics we went to that were run pretty poorly, and the managers were ineffective and the staff didn't respect them and things like that. And there's other ones we went to that ran really well and everyone was in a good mood, and even things with like how they scheduled patients, how their intake paperwork was, all of these things that we saw at some clinics that they did really well and some clinics they did poorly. And we can take that experience, depending on your situation. If you go to a permanent job later, you can bring that experience with you and make your permanent clinic better. And you can give the manager there these insights that you've picked up and little tips that they would never know. And I think that type of learning or that type of mentorship essentially can be really valuable. Learning from a bunch of different clinicians, learning from different settings, learning from different facilities within a specific setting.
Yeah. The word I couldn't think of earlier was intangible.
Intangible
Benefits. Because it's not something that you can just easily grasp. It's not easy to describe, but it's like, you are still getting a benefit from this in a type of mentorship. So yeah, as Jared said, to be honest, like when we've applied for a lot of jobs or ended up at new facilities, because we had so many different experiences working at other places, sometimes the managers would ask us for advice, even though we're just there for 13 weeks and we're not managers or anything. They would say, what's your experience been at other facilities? How did they do this there? Do you have any advice for us on how, things that could run better here, or things that we could do differently, or things like that? So we were surprised to find that, they were really asking us for advice based on our variety of experiences.
And very often we do have some advice, some kind of thing that we can mention that will help improve their processes from a variety of perspectives. So that can be very valuable to clinics later, and it can be valuable to you, especially if you're going into a clinic, or even if you want to make your own clinic in the future. I have a pretty good idea of how I would run an outpatient clinic now, from going to a bunch of different ones and seeing what works and what doesn't.
Yeah. So I think there's a lot of things that you can learn and grow from as a traveler. Whether or not you're getting the exact same type of mentorship that you maybe would at a perm job, I think that there's a lot of ways that you can get mentorship in all these different variety of ways. And then also you can grow as a clinician and be more well-rounded by having gone to all these different settings, facilities, worked with different clinicians, and learned a lot that way. The last thing I will add, in addition to what the travel company can provide for you, in addition to what the facility can provide for you, and just the general overall experience can provide for you, you may still just be thinking like, I still need like a real mentor, like someone who can really help me be better. Well, keep in mind, you can always reach out to someone else outside of travel to be your mentor. You can always go back to one of your professors, one of your CIs, connect with someone some other way that you might know online or whatever, and say, hey, would you mind being a mentor to me if I have questions? And a lot of times your CIs will be very supportive. I definitely emailed some of my CIs back in my first couple of years of practicing to be like, hey, I remember you had worked with this type of diagnosis before. Do you have advice and that sort of thing? So your network can be bigger than just the facility you're at. And again, I think this would be the exact same thing if you were in a permanent job, because you're not always going to have all the answers from the other person who works there with you. They may not be helpful. There might only be one other PT. We've worked at a lot of rural places where you might be the only PT if you're a permanent staff, or you might have one coworker, and like Jared said, maybe they're in a rut. Maybe they've been there for 30 years and they don't actually do things the best, and you don't really want them as your mentor, whether you're a traveler or a permanent therapist. So you can reach out to other sources. There's nothing stopping you from doing that, and we highly encourage it.
Yeah, that is often overlooked, but I mean, I learned so much also outside the clinic my first few years, just from doing my own research, from reading blogs of therapists that were way smarter than me, watching videos of other therapists, how they did things, CEU videos, things like that were really, really helpful in me being more well-rounded clinician. That had nothing to do with whether I took a permanent job, a travel job, but that was like very valuable for me to be the best clinician I could be.
Yeah, definitely. Continuing to do research and continuing to learn is very important. But you also have to realize, like, when we come out of school, with the exception of our colleagues that are SLPs that have to go through their clinical fellowship year, but after they get their clinical fellowship year, after you're an OT and you're a PT and you're licensed, you're an entry-level clinician. You're allowed to practice by yourself. You should have learned everything that you need to know to confidently practice and do a good job. Now, you may not be at the top of the practice that you're ever going to be at that time, but you're entry level. And so there's lots of different ways that you can continue to learn and grow as a clinician on your own by self-study and reaching out to other mentors in different settings to continue to grow. But you're ready. I mean, whether you you might have this little bit of imposter syndrome and be like, I don't really know if I'm ready, but you are. I mean, you're an entry-level clinician. You're allowed to practice on your own. And as long as you feel pretty good about it, you can go into traveling, just knowing that you have these different ways that you can find a support system.
Yep.
All right, so we have a couple of comments and questions here. If anybody else is watching live and you want to leave a comment, ask us a question, we'll read that and go through it. Again, if you are watching live, we'd love if you would just hit the thumbs up button, let us know that you're watching and that you like the video. But yeah, if anybody has any questions, we'll answer those. All right, hey Juan. Juan says, that's good that you can have the experience of working with a bunch of PTs. Juan wants to know, have you worked with patients that didn't speak English?
Yes. Actually, one of our first, my second contract, I guess it was Whitney's probably third contract, because I stayed at the first one for a long time. We worked with, we didn't even realize this at the time, but we went to a town that was close to Boston that had probably the caseload, I would say, was at least 30% non-English speaking, or maybe even more. And that was a very interesting situation that we had no idea really how to handle, because we'd never worked in a clinic with a lot of non-English speaking patients before. And so some of them would come in with translators. Some of them we had to try to use an iPad to have a virtual translator. Some of them we would obviously you try to communicate as much as you can with hand gestures, and we know a little bit of Spanish. So some of them were Spanish speaking and that was easier. Some of them were Portuguese speaking or like Haitian Creole speaking that we had no idea. And so that is definitely a situation that you can run into, and it definitely helps you grow as a clinician too, because you have to learn how to be concise, you have to learn how to demonstrate things well, and yeah, I mean, there's a lot to learn from that.
Yeah, but hopefully you have some kind of support at your facility if that happens. If you do need a translator, hopefully they have some type of system set up for you if you do need a translator. On the flip side, if you're someone who does speak a second language, that can be really helpful. I don't know all the rules on that, but from my understanding, I think that you have to have certified that you have taken medical, Spanish or medical, whatever that language is, not just like, oh, I learned a little bit of French in high school, I can do this. I think you have to have some kind of actual certification to show that you're allowed to communicate with this patient in your non-native language.
Yeah.
But if you're bilingual and that's not an issue for you, then that would be awesome. It just depends on the geographical area of the country on if you're going to see a lot of patients that speak different languages. Obviously, if you're in a more metropolitan area, or you're maybe in like the southwest or the southeast of the country where there might be more diversity, more Spanish speakers or speakers of another language. It's just going to depend on the area.
Yep.
If that's very common or not. Nick says, nice beard, Jared.
Thank you.
You're lucky, Nick, because he was about to shave it. So
Whitney hates it, so.
I don't hate it. I just think it's gotten a little unruly. So it could be getting trimmed soon, but we'll see. But
yeah,
I'm sure Jared appreciates the compliment.
Yep.
All right, let's see if anybody else has any other questions. All right, well, if nobody else has any other questions, feel free to reach out to us later. If you do watch on the replay or listen on the podcast, feel free to send us a message if you have more questions about mentorship. Again, Jared also wrote an article on this topic that you can find on our website. Oh, we just had another question come up. So Brian said, I was looking into your course, but the code PT month wasn't working. Brian, if you want to send us a message right when we get off the video here soon, I can try to troubleshoot with that with you. It should still be valid.
Yeah, it should be until midnight, but sometimes there's like glitches on the system. Yeah,
so I can try to help you with that if for some reason it's not working. And if needed, I can always extend the code till tomorrow if some people are having trouble with it tonight. Sometimes it does funny things with time zones. I try to always be like err on the side of caution and put it at Pacific, even though we're Eastern, but yeah, if anybody else has any trouble with the sale code, let us know.
Yep.
And we can help you out with that. But yeah, check out that article about mentorship. If you're someone who's thinking about getting into travel therapy and you're just very uncertain, please send us a message. We can absolutely help you. We have talked to, mentored, educated just thousands of therapists, clinicians, and students, all different varieties of experiences, whether or not you're a brand new grad and you're not sure about it, or you're someone who's been in the field for 30 years and you're thinking about just switching settings. We've heard it all, so we can definitely give you some advice and get you set up with some good recruiters, hopefully, too.
Yep. So don't forget the giveaways. We're doing a lot of giveaways. We've got another giveaway coming on Instagram in just a few days. So if you're not following us on Instagram, follow us there. And those year-end giveaways, those are always a lot of fun. So if you're eligible for those, then make sure to fill out the forms.
Yeah, so the year-end giveaways, I didn't mention all of those. The one is if you leave us a review on Facebook or the podcast, you can just send us a screenshot and we'll get you entered for that giveaway. That'll be for a $100 gift card. Also, if you're in our course group already and you leave us a review on the course, you'll get entered to win $100 for that one separate. If you have taken a job with any of the recruiters that we've recommended to you this year, we could have recommended them to you in the past, but if you took the job this year and worked a full 13 weeks or more, you can fill out our contract completion form to let us know that you took a contract, which recruiter it was with, give us some feedback about that recruiter, and then you'll get entered to win one of 5 different $200 gift cards. So we're going to give away $1,000 total, spread out between 5 different therapists.
Yeah, and those forms are really helpful for us. The reason we do these giveaways is so that we can get feedback about the recruiters. We can add good ones, we can subtract ones that aren't doing as well. It's really helpful to get that feedback. So, you know, normally we send people to 3. If you take a contract with 1, fill out the form, and let us know about that one. But if you could just let us know what happened with the other 2 as well, that's also very helpful. You know, were they not responsive? Is that why it didn't work out? Are you just waiting? The contract didn't work out? Like, you know, we want to know those things so that we have a better idea of who to send people to in the future.
Yeah, and we always follow up on your feedback to make sure that if you didn't have a good experience with the recruiter, why? We want to make sure that we're recommending the best recruiters to other therapists. So you're really helping us out with our processes and everything. By filling out those forms, and then you'll also get entered to win the giveaway as well.
Yep.
So check out, we'll kind of advertise some of those on our newsletter and on our social media over the next couple months. All of those giveaways will be at the end of the year around December 31st. But for PT month specifically, we are going to be giving away something really cool the week after this week, so on the 23rd.
Yep.
So keep an eye out for that as well.
All right. We'll see you guys in a couple weeks.
All right. Bye, guys. Have a good night.
Bye. Take care.